Most of us just try to ignore shoulder pain as long as we can. Take some over-the-counters, Google and stretch, and then try whatever's worked for someone else, looking for anything that can finally make it stop, because nobody wants to believe that this might become a problem. Then one day, we realized this should have settled down by now, but it didn't. Now, at first, shoulder pain only shows up during certain movements, reaching, lifting, throwing, sleeping. Then one day you realize that you're planning around your shoulder pain, and it's not just a pain management problem. It's often a functional problem that changes the way we move, the way we rest and recover. And at first, our bodies compensate, finding a way through until everything starts feeling like more effort, more tension, more fatigue. Sleep gets less reliable. Patience runs thin. Focus takes more work, and trust in our bodies takes a hit. Eventually, it stops feeling like a bad day and starts feeling like the new normal. That's when most people start chasing symptoms. Many new patients have already tried massage, medication, physical therapy, acupuncture, injections, manipulation, and even surgery. And often that helped for a while, but then it came back, because treating symptoms isn't the same as restoring function. Well, not enough for our bodies to actually recover. And that's why we don't just chase the storm of the most current symptoms. We listen, and we look for where the body is working harder than it should. There's no one-size-fits-all answer. Treatment here may include Instalign Massage, PEMF, Shockwave, rehabilitation, or nutritional support. And most of the time, the missing piece for most people is the specific spinal adjustment. There's no twisting, jerking, or cracking, just precise correction designed to improve motion, function, balance, and overall quality of life. Most patients get immediate relief and a measurable change that finally makes recovery possible. But lasting results usually requires some repetition and reinforcement. Side effects are rare, usually mild and temporary, and they may include soreness, stiffness, bruising, fatigue, dizziness, or a brief increase in symptoms, and serious complications have been reported in the literature. They may include disc, nerve, rib injury, paralysis, or stroke. The big difference here, besides no twisting or cracking, is that the goal is more than just temporary relief. It's life without thinking about every movement, without letting symptoms run the schedule. Until easy is normal, I'm Santa Clarita chiropractor Dr. Thomas Polucki.